Hi everyone, welcome back to N.O.A the Explorer. Thank you for watching. Thanks for being here. I know you can spend your time doing other things, so thanks for watching. I had a video, I believe it's titled Seeing a Psychiatrist for the First Time, What to Expect. And in that video, I went over how a new patient intake typically goes. And I got a lot of questions, so many comments. Lots of you really enjoyed the information, so thanks for the feedback. But I did get some really good questions that I really wanted to do a follow-up to that video to address some of those questions. So the first question is, do I have to get a medication or take a medication if I see a psychiatrist? The answer is no. So you need to have a conversation with your physician or mental health practitioner, non-physician provider, that what's the alternative to medication? Can I do something else other than medication? What else do you recommend? So that's a conversation to have. If someone recommends medication, whether it's a psychiatrist or any other physician, really, you need to ask them, what's the alternative? What's the risk? What's the benefits? What's the side effect? And really, what should I expect taking this medication or not taking this medication? However, do understand that when you see a psychiatrist, we are trained in psychopharmacology extensively. What that means is we are trained in how to use medications to treat psychiatric diagnosis and mental illness. So if you come to see us, we may or may not recommend medications. And a lot of psychiatrists, as I mentioned in my first video, do a lot of medication management for psychiatric illness. Some of them will do therapy. It depends on the type of therapy that they are trained in and comfortable doing with you. However, a lot of psychiatrists will do medication management, just given the nature of the landscape that we work in. And I can do a separate video about, different work environments and constraints, because I'm actually about to start looking for work soon. It's really hard to find a job that pays well and pays you the average salary that your peers are making, while also allowing time for you to do several hours of therapy every day. It's very difficult. So a lot of places will really only hire psychiatrists to do medication management. So that's why it might seem like all we do is prescribe medicine. Usually we're recommending both at the same time, because honestly, by the time someone comes to see us, it's likely that medication management would be recommended at that point. Most people who do very well on psychotherapy alone, they don't typically come and see a psychiatrist. So the answer is no, you don't have to take medicine, but we usually will recommend it, as well as other alternatives to treatment, if not medication. So that leads me to my next point about psychotherapy. I think I touched on it towards the end of that first video about seeing a psychiatrist for the first time, but it's really important to look for different therapists, especially now when there's such a shortage of therapists. So it's very difficult right now to find a therapist. It was difficult before the pandemic. Now after the pandemic, it's even worse. There's a huge need. What I tell my patients right now is that you need to call several places multiple times. So if you get a list from the psychiatrist's office or from your primary care physician's office, or a list online, you need to call several places and try to get on multiple wait lists over and over and over again. Unfortunately, that's the landscape that we are in right now, and you have to keep following up with them and asking them if there's an opening multiple times. That's usually how people find a therapist these days, because there's so many things like, will the therapist accept your insurance? How much is the copay? How far away is the therapist? Is it in person? Is it online? So you really just have to call a lot of places and ask all these questions. And then when you finally meet the therapist, they might not even be a good fit for you. So don't be discouraged if you meet the therapist and you're like, ooh, I don't really think this is a good fit. Now I have to go find somebody else. So that's why it's always good to maintain that list of places you've called. And so when you meet the first person, after a few sessions, you're like, I don't think this is working. I actually encourage you to tell your therapist that you don't think that you're a good fit, or that whatever therapy style that they're using is not working for you, because there are different psychotherapy modalities. There's different types of therapy that we can do with patients. So just let them know, hey, this is really not working. This is our third session and something is just not clicking. It could be that you're not a good fit with the therapist, or it could be they need to change their style of therapy to suit your needs. So I would encourage you to communicate that with the therapist. People have told me that as well when I do psychotherapy, and none of us would take it personally. At least any well-trained therapist should not take that personally. It's either we can change our therapy style, or we'll say, you know what, you're right. I do think you need a different therapy type, but I don't do that. So here are some people who do, and you can go ahead and start calling those people as well. So another point I wanted to touch on is that you may not always get a diagnosis the first time you see a psychiatrist, especially if your history is extensive and complex. So you've had a psychiatric history for a long time, maybe since you were a child. Then we really want to do our own interview. It's not that we don't believe what you're saying or we don't trust what you're saying, but part of the training that we have or we do as psychiatrists is that every time I see someone for the first time, this is the first time I'm seeing them, and I have to get as much information as I can myself. So I may have your records with me. I may have your old psychiatrist notes. I may even call your old psychiatrist or your former psychiatrist, but I still have to gather your history and then come up with a diagnosis. And of course, feel free to ask what that diagnosis is. I actually get a lot of people come in and I say, well, what have you been, diagnosed with before? And they're like, I don't know. Feel free to ask. I mean, you can ask, and you can ask us about the diagnosis for that visit. It's likely that for the first visit, like I said, you may not get a diagnosis at that very first visit, but after a couple of visits with the psychiatrist, they should be working with a diagnosis or something that they're treating specifically. I had a comment asked about what if I don't feel like sharing any information. I would assume that the reason you're seeing a psychiatrist is to tell us what mental health problems that you're having or mental health issues that you're having, and hoping that we can come up with a solution together. But if there's a topic that you don't particularly feel like sharing with someone you just met for the first time, that's absolutely fine. A lot of my patients with extensive trauma history don't necessarily feel like going into all that in the first visit. That's something we can tease out the details at the follow-up or the next couple of follow-ups. But in the first visit, we may not go into extensive details. So if there's something that you don't feel comfortable sharing in detail, by all means, that's fine. A lot of places will give you 60 minutes for a new patient visit, but it might not be the entire 60 minutes that you're talking to the psychiatrist. And that really leads me to my next point, is that just because the appointment time says 60 minutes or 30 minutes or 20 minutes doesn't mean that we will be talking for that entire time. For me as a trainee, it's even more constrained because I have to talk to you, and then I have to go present to my attending, and then I have to bring my attending back with me to talk to you as well, all in those 60 minutes. So I think it's safe to say that I'm always behind because there's just no way I can, talk to you and get all this information, the information I talked about in the first video, try to get all that information, go get my attending, come back, talk to you again with the attending, talk about the plan, have time to ask questions and answer all the questions, all in 60 minutes or 30 minutes for follow-ups, or even 20 minutes for follow-ups. And most places you get between 15 and 20 minutes for follow-ups. So that's the visits after the first one. So the first one will be the longest, and that's it. Every visit after that will be short. So it's really important that we try to, what we say, manage the time so that we can get to what's really most important to you. And then there are questions that I have to ask at every visit, mostly safety questions, to make sure that you're safe at home, you're safe to go home. And then also seeing how, if we prescribe medication, how the medications are working. If we're not prescribing medications, how therapy is going for you, things like that. So it can feel strained for time, because we are definitely very constrained for time. So I truly appreciate everyone who waits patiently for their appointment, because there's just so much going on in the background that you might not see. If I'm not in training, if I wasn't in training and I was a board certified psychiatrist, then I would still talk to you probably for 45 minutes and then use the last 15 minutes to ask you if you have any questions. If we're doing a medication, that's when I'll send the medication to the pharmacy and then try to type my note. Like I said before in my first video, I cannot type and talk at the same time. I might be able to jot down a couple of notes, really tiny bullet points, and honestly half the time I can't even read my own handwriting, but I cannot type and talk at the same time. So unfortunately I have to also take a couple of minutes out of the 60 minutes or 20 minutes or even 15 minutes that we have to be able to jot something down. So that further decreases the appointment time. So there's a lot of administrative tasks that we have to do as physicians, and it really cuts into the time that we see patients. And if you don't have admin time, which is the administrative time set aside for all those things, then you're having to do it while you're talking to the patient. So I know it's frustrating if you go to the doctor and they're just in front of a computer, but these are some of the things that are going on in the background. Feel free to ask about money, right? It's important. Please do ask, how is this going to be billed? How much do I have to pay? If you haven't already, usually if you call the front desk and you ask to see someone, they'll probably take your insurance information and let you know what the copay will be. But if it's a private psychiatrist that doesn't accept insurance, by all means, bring it up and say, how much is this going to cost me and how much would the follow-up be? That's okay. Feel free to talk about money, because it's very important, and you don't want to get a surprise bill. So there's different types of mental health practitioners. So psychiatrists are physicians. We are medical doctors who go through training and residency to be able to see adult patients from 18 and up. And then if you do a child psychiatry fellowship like I'm doing, you can be able to see patients that are younger. But also there are different acronyms and alphabets that are also mental health practitioners, such as non-physician practitioners like nurse practitioners and physician assistants. I believe, Med School Insiders, there's a YouTube channel. I think I'll just link them in the description. They did a really good video about the differences between MD, DO, PA, physician assistants, and NP, nurse practitioners. And so the same goes for therapy, right? You have licensed clinical social worker, you have people who have licensed professional counselors, so LPC, LCSW. So there's so many different acronyms. So I think it's actually important that you ask, what are your credentials? What are you doing? What are you treating me for? How did you get those credentials? How long have you been training? What's your experience like? I'm not offended if you ask me that, quite frankly. People ask me that all the time because apparently I have a baby face. So they're like, how old are you? Again, I really am not offended. I'll tell people my training and what I'm doing and why I'm here and why I'm seeing you and how I came to be here. So please, there's a lot of acronyms and alphabets out there, so please ask. But I will link the video by Med School Insiders in the description box because I think they do a very good job explaining it. So the last thing I wanted to touch on is that the psychiatric treatment process will be a long process. So usually on average, people will try 3 or 4 medications before you find the right one for you. And also people will try 3 or 4 therapists before you find the right fit for you. So please don't get discouraged if it seems like it's taking several weeks or several months, if not up to a year, to find the right treatment for you. Sometimes you see a psychiatrist for the first time and then they don't have any follow-up appointments for like 6 weeks. That's really what's going on right now. There's such a huge need and such a huge shortage. I'm seeing people in July and I don't have a follow-up for them until September. So it can take a while for you to even come back and have the follow-up appointment and then go home and try the treatment and then come back again. So that could take a long time. So please don't get discouraged that it is taking a while to come up with a treatment plan that works for you. And just keep working with us to find the right treatment for you. The first time you see a psychiatrist may not actually be outpatient. Sometimes the first time people see a psychiatrist, it will be in the hospital, and that's a totally different setting and scenario, which I think I'll just have to make a separate video about that. So much of what we've been talking about, everything I've been really saying up until this point, is outpatient, right? Outside the hospital. Inside the hospital, things can work differently. It's more geared towards acute crisis stabilization. You only stay there 1 week, no more than 2 weeks. Usually it's about 2 weeks for children and 1 week for adults, maybe even less is the average. So things work a little bit differently inside the hospital. So I think I'll just make a separate video about that. But I just wanted to say that most of what we've been saying so far in this video and that first video about seeing a psychiatrist for the first time has to do with outpatient. So not in the hospital, but outside the hospital. I believe that's everything I really wanted to touch on for the follow-up to seeing a psychiatrist for the first time. I'm sure I'm missing something. So if you have any follow-up questions, let me know in the comments and maybe I'll make it part 3. I don't know. There's so much to talk about. If I need to make another video, I will. Just let me know in the comments what questions you have. I really cannot give any personalized medical advice on this platform, but if it's anything that I think will be beneficial as a general information that the public would like to know, then of course I will answer. So feel free to comment down below, and thank you so much for watching. I know this is a long video, so if you made it to the end, absolutely thank you, and I'll see you in my next one.